Hello everyone, welcome to the Lab Informants. This is a platform that helps you to understand about your health conditions and also the role of laboratory in diagnosis and management of these health conditions. It is your presenter, Eric Masiga, and today we are discussing with you about female infertility. In our today's focus of attention, we will help you understand what is female infertility, what causes female infertility, what are the risk factors of female infertility, what are the signs and symptoms of female infertility, diagnosis of female infertility, and majorly laboratory diagnosis of female infertility, and evaluation and treatment of female infertility. What is female infertility? Female infertility simply means a woman not being able to get pregnant after at least 1 year of trying to get pregnant, or 6 months if she's over 35 years of age. It is also important to note that women who have had subsequent miscarriages are also said to be infertile. What causes female infertility? Apparently, fertilization happens when an egg is released from a woman's ovary by a process called ovulation, and this egg successfully meets and fuses a sperm cell in the fallopian tube. Once fertilization takes place, this newly fertilized egg, called a zygote, moves down the fallopian tubes into the uterus and then burrows into the uterus lining. In simple steps, fertilization process involves egg production, egg release from a woman's ovary by a process called ovulation, egg going through the fallopian tube towards the uterus, the egg meeting and fusing with the sperm cell in the fallopian tube. The fertilized egg must attach itself to the uterine wall, and thereby infertility can result from a problem that can interfere with any of these steps. Therefore, female infertility can be caused by egg reserve, egg development problems like hard eggs or teratogens, elevated prolactin levels, ovulation problems, and mainly when there is a disruption in the part of the brain that controls luteinizing hormone and follicle stimulating hormone. These are hormones that are responsible for menstruation periods. Infertility can also be caused by early menopause, polycystic ovary syndrome, which produces too much androgen or male hormone. Thyroid problems can also cause female infertility, and as well as anti-sperm antibodies. What increases the risk factors of female infertility? A woman's age, stress, poor diet, smoking habits, alcohol consumption, being overweight or underweight, caffeine intake, too much exercise, and having a history of sexually transmitted diseases such as chlamydia and gonorrhea increases her infertility risk. What are the signs of female infertility? Amazingly, infertility is often something that people do not consider until they are actively trying to start a family, or in many cases after they have started having problem conceiving. So here are some warning signs of infertility that you shouldn't ignore. To begin with, changes to your menstruation cycle, and this could be irregular periods, especially when the number of days in between each periods varies in each month, or sometimes no periods, that is especially when you have never had a period or your periods suddenly stop. Painful periods, in most cases having back pain, pelvic pain, and cramping may happen, or abnormal periods like when the bleeding is heavier or lighter than usual. Secondly, having sudden unexplained weight gain, significant hair growth or hair loss, sudden skin changes like severe acne breakouts as an adult, and last but not least, having a dark hair growth on the lips, chest, or chin as a woman. Diagnosis of female infertility. A comprehensive range of diagnostic tests are done to get to the root of infertility, which then allows a doctor to give you a personalized, complete care. Some of the tests that you could undergo are having a male partner semen analysis, hormonal analysis like follicle stimulating hormone, luteinizing hormone, prolactin, progesterone, estradiol 2, anti-mullerian hormone, thyroid function test, and androgen. Thirdly, a doctor may also order pelvic ultrasound, hysterosalpingogram or HSG, ovarian reserve testing, diagnostic hysterolaparoscopy, a transvaginal ultrasonography. Laparoscopy, the uterine cavity is examined with hysteroscopy, or even having a genetic testing to help determine whether there is a genetic defect causing infertility. Laboratory diagnosis of female infertility. Here are some of the lab tests that are performed to help diagnose and evaluate infertility. Male partner semen analysis, analysis of hormones, Thyroid-stimulating hormone and prolactin levels are useful to identify thyroid disorders and hyperprolactemia, which may cause problems with infertility, menstrual irregularities, and repeated miscarriages. Total testosterone levels, lupus anticoagulant test, anti-cardiolipin antibodies, urinary luteinizing hormone, and genetic health testing. Evaluation and treatment of female infertility. Evaluation may begin sooner in patients who have risk factors for infertility or if the female partner is older than 35 years. A history and a physical examination can help direct the evaluation. In some cases, the etiology of female infertility can be broken down into ovulation disorders, uterine abnormalities, tubal obstruction, that is fallopian tube obstruction, and peritoneal factors. Cervical factors are also thought to play a minor role, although they are rarely the sole cause. Evaluation of cervical mucus is unreliable and therefore investigation is not helpful with the management of infertility. Couples who have no identifiable cause of infertility may be cancelled on timing of intercourse for the most fertile period, that is 6 days preceding ovulation. I am certain that takeaways from this channel furthers and deepens your thinking and equips you to stay informed and on top of your health. Please share, like, and subscribe. Thank you. Bye-bye.